Our top story this hour, India will have more than 2 billion vaccine doses by December to inoculate its citizens against the virus. India's top government advisor made the announcement on Thursday.
इसमें 216 करोड़ अगर हम इस सीन को लेकर चले डोसेज भारत में निर्मित होंगी। अब इसमें रिस्क उतना माइनस कर दीजिए, बट टू बी प्राउड टू से दैट 2 बिलियन डोजेज इन अ मैटर ऑफ 7-6 months or 5 months actually will be made in India for India, for people of India. तो इसमें कोई दो राय नहीं होनी चाहिए कि वैक्सीन will be available for all as we move forward.
Now, assurance from the Indian government comes as more and more states complain of vaccine shortage. In the daily health briefing, V.K. Paul, a member of India's Planning Commission, said that more vaccines will be available for future use apart from Covishield and Covaxin. Now, as per the Indian Health Ministry, 8 vaccines will be available in India between August and December. These include AstraZeneca and Serum Institute's Covishield, Bharat Biotech's Covaxin, the BioE subunit vaccine Novavax, Sputnik V, Bharat Biotech intranasal vaccine, Genova mRNA vaccine, and Zydus Cadila DNA jab. Now, the Indian Health Ministry has not included COVID vaccines by Pfizer, Moderna, Johnson & Johnson and Sinopharm in the availability tally. And Paul said that the government is in talks with the manufacturers and have officially asked the firms if they would like to send their doses or manufacture in India. Earlier in April, the Indian government had approved recommendations for emergency use of COVID jabs approved by US, Europe, Japan and the UK. Indian states are also planning to float international tenders to procure COVID vaccines. The government of Uttar Pradesh has said that it will spend over 1 billion doses to buy the jabs. Earlier this week, the state government had also held early talks with companies such as Pfizer and the local distributor of Russia's Sputnik. Sharing some much-needed good news, Paul also said that the government of Sputnik V have arrived in India and the Russian jab will be available in the market from next week. Now, India is currently battling its second deadly wave of COVID-19 infections. Successful implementation of vaccine plan will, of course, offer India some respite as well as aid that it needs to battle the virus. India started its mega vaccination drive in January. Until now, it is using Oxford AstraZeneca's Covishield and India's indigenous Covaxin. India is one of the few countries around the world where all adults are eligible for getting the jab against COVID. India administered over 170 million vaccines till Wednesday. And for more on this, we are now being joined by WION's principal diplomatic correspondent, Siddhant Sibal. Siddhant, thank you for joining us. Now, you know, more and more states have reported a shortage of vaccines, but now this new plan does not just mean that there will be more vaccines, but there will be also other vaccines apart from Covishield and Covaxin that will be added to India's arsenal to battle this fight against the virus. What can you tell us about this plan and how effective do you think it will be?
Well, the Indian authorities yesterday exuberated confidence when it comes to the vaccination process here in India. We know that India started mega domestic vaccination process in January, and so far 18 crore Indians have been vaccinated. That is the smallest amount of time any major country has taken to vaccinate these many people. And of course, 1/3 of the people above 45 years of age have been given 1 dose of vaccine as well. Of course, right now, India is banking on Covishield and Covaxin, we all know. And Sputnik, and the second batch of Sputnik vaccine, 1.5 lakh, is expected to come today. And from next week, Sputnik vaccine will be available, these 3 lakh vaccines, which will be in India. But as you pointed out, as the officials yesterday gave out the list of vaccines, there are a lot of Indian vaccines, biological E, Zydus vaccine, there are the mRNA vaccine. These are the vaccines which are still yet to get approval from the drug regulators here, and only then there can be something on the ground. The vaccines can be given to the people. But by and large, a roadmap has been set in place, and according to which from a period from August to December, there will be approximately 2 billion vaccines. That, of course, in a sense, is a very positive news, a heartening news at a time when we know that there are reports of vaccine shortages, crunches in various places across the country. In fact, there are reports here in National Capital as well, something which has been dismissed by the government and, of course, the officials as well. In fact, the officials also said by the next year, by the first quarter of next year, that's the January to March period 2022, there will be 3 billion vaccines here in India. But nonetheless, India is taking a cautious approach. We know the mega outreach program, the Vaccine Matri program, in which India gave vaccines to more than 90 countries, has been put on pause. And we do not see it to be started very soon, given the fact that India's priority is its own people. And that, of course, has impacted vaccination programs in India's neighboring countries.
All right, Siddhant, thank you so much for joining us with all the information on that. WION is now available in your country. Download the app now. Get all the news on the move.